Asthma WA's vision is that every West Australian impacted by a respiratory condition can live their best quality of life.
Asthma was impacting my life in many ways. My sport, my gym, my day-to-day life, housework. I'm a pretty positive person, but sometimes my asthma just really gets me down. I've been going to GP. Yeah, there was just not a lot of education. It was just like, you've got asthma, okay, here's something, get out now. And quite often I wasn't better and I would always go back and get my antibiotics. It's been a thing all my life.
I started feeling like I couldn't catch my breath when I was doing anything.
Seeing him get sick quite quickly with that underlying asthma, that was really significant for us.
I'm asthmatic myself. My son Bilal dad, he's suffered with asthma for most of his life. When Bilal was frequently getting asthma and going into hospital, she started to deteriorate. I knew she was in trouble. That was a very scary time for us.
Airways diseases are incredibly complex. There are a few diseases that we look into here, not just asthma but COPD. We're bridging the divide between GPs and specialists in the hospital. Asthma WA is a great hub for not just diagnostic testing but education and making sure that the patient has action plans that they can follow.
Asthma WA fills that gap of being able to provide relatively quick services with very competent nursing and medical staff to provide appropriate asthma care.
Delilah having all these tests done, and I thought this is really good because we're going to get to the bottom of it. And it was a great experience, really good support, strong support. We're so lucky to have a facility like that.
I really appreciate all the support they're giving me and all the medication they're helping me with. And it's helping me understand my asthma a lot better.
The team here are exceptional. You can just feel that it's something they are passionate about and enjoy doing. We think it's an incredible service, so really grateful.
It's all about education and understanding and coming to a place that is armed with all that. My life, I think, is just really, it's excelling, I would say, because I've learned a lot about my asthma. Because there was someone that actually understood 100% what I was going through.
So one of the exciting things that we've been working on over the last 12 months is the expansion of our respiratory hubs. So we have both paediatric and also adult respiratory hubs speckled across Perth Metropolitan, and also a new Southwest respiratory hub which has recently opened in Bunbury.
The paediatric respiratory hub, you have an asthma nurse there, myself there as a specialist. You've got a lung function scientist. We can give one-stop shop and we give them everything they need for the diagnosis and to help with their management as soon as possible.
This respiratory hub model saves consumers and also their families about 2 years of diagnosis process and thousands of dollars in medical bills. I'm excited to announce that from now we'll be known as Respiratory Care WA. The core purpose here is really to show that we do offer services for both asthma, which is really important and close to our heart, but also COPD, which we're seeing a massive prevalence and a really big issue in the community. And ultimately help more West Australians impacted by a respiratory condition live their best quality of life.
No one's ever cared that much about my asthma, apart from my mum, but it's like a big warm hug. That's how it feels going to Asthma WA, a big warm hug.